So I have an announcement that I've been waiting 10 months to be able to share with you guys. Any idea what it's about? Hey guys, welcome back to the DrCliffAuD vlog. This is vlog number 236, and today I have some very exciting news to share with you guys. But before I get into it, do me a huge favor, click the like button. If you are not yet subscribed to the channel with notifications turned on, go ahead and do that as well. It's greatly appreciated. So, the big news that I am going to be sharing with you guys today for the very first time is that we are officially launching Modern Tinnitus right here in Scottsdale, Arizona. Now, let me go into a little bit of a backstory with you guys. So you probably already know that I have tinnitus. I have tinnitus in my right ear. I was diagnosed with it back in 2002 when I was in the military. Now, I also have hearing loss in my right ear that you're probably also aware of, and both of those are probably going hand in hand, quite honestly. Now, I've talked about tinnitus on this channel and honestly, the very first video that I posted on this channel was about tinnitus, that there's not a cure for tinnitus, but you have a variety of different options if you want to address your tinnitus. And literally my first video ever back in, I think it was July or August of 2017. Now, you're also probably aware that I primarily talk about hearing loss and treatment of that hearing loss with hearing aids on this channel. But I've been creating content around tinnitus really since 2017. It just is a small fraction of the video content that I put out on this channel, but they are some of the most viewed videos that I ever put out on this channel as well. So there's clearly a demand for information about tinnitus and treatment options for tinnitus. So let's go back into October of 2023. So 10 months before filming this video right now. I actually had a colleague reach out to me. His name is Dr. Craig Casper. The reason he reached out to me is because he specializes primarily in treating tinnitus, and he's done it for literally decades at this point, which I don't even know how it's possible because he does not seem like he's old enough even to have treated tinnitus for literally decades. But he's the founder of New York Hearing Doctors in Manhattan, New York. Now, he reached out to me because he knows that I specialize in talking about best practices when it comes to audiologic care, specifically for hearing loss, in treating hearing loss in adults with hearing aids. But he proposed a couple of different problems to me with how tinnitus care is approached in the United States. So first and foremost, there is very limited access to high quality tinnitus care in the United States and quite honestly, worldwide. Now, most clinics that treat tinnitus are primarily hearing aid clinics. And so even if they have hearing aids and tinnitus in the name of their clinic, primarily their focus is hearing aids, and most of those clinics use hearing aids to treat the tinnitus. In fact, that's the only thing that they do to treat the tinnitus. But just amplifying sound for an individual only works about 5 to 6 times out of 10. So it doesn't work for everybody, but that is literally the only option that they will give these individuals. They don't have anything beyond just amplifying for a hearing loss that is probably the underlying root cause of the tinnitus. But if that doesn't help, then you're basically out of luck. On top of that, a lot of people who go into their primary care physicians who complain of tinnitus, their primary care physicians are like, well, there's nothing that you can do about it, so you just might as well learn to live with it. And that could not be further from the truth. So now back to Dr. Craig Casper. He's been successfully treating tinnitus, like I said, for decades at this point, using different strategies and focusing on different things. And so it's more of a comprehensive approach to tinnitus care rather than a one-size-fits-all, this is the only way that we treat tinnitus, and if you do not have luck with that treatment method, you're basically screwed or you have to go somewhere else. So he was thinking like, well, here's the deal. Dr. Cliff Olson has this broad reach of information talking about best practices when it comes to audiologic care, but what about the best practices when it comes to tinnitus care? There's not a whole lot of universal information out there about multi-treatment approaches to treat tinnitus. And his entire method is based on a holistic approach. It's not a one-size-fits-all where you just pick one treatment option, throw that at everybody, cross your fingers and hope that that works. And if it doesn't work, you're just like, oh, well, we tried. There's, I guess, nothing that you can do. No, there's a different approach for literally everybody. Now, when I talk about about different approaches, let me list out a few of them for you. This includes bimodal neuromodulation using the linear tinnitus treatment device, or hearing aids, or sound therapy, or sleep hygiene, movement and exercise, psychology and breathwork, counseling, and even biomarker tracking. Now, the thing that's most successful for you might be one of those, 7 different things that I just mentioned, or it could be a combination of them. Because one thing that's true for all individuals with tinnitus is that more likely than not, it's not just one thing that you need to address to reduce the perception and annoyance of your tinnitus. You usually have to look at your entire lifestyle and make sure that you're making adjustments in a variety of different areas to reduce your perception more successfully. Now, you also heard me mention biomarker tracking. Now, this is really exciting because nobody else is doing this. This is actually taking objective data from you as an individual from either a Fitbit or an Apple Watch that you are wearing that will allow us to take that objective data to see how effective different treatments are working for you. It will also potentially allow us to adjust your treatments to make sure that we're having an objective improvement on your tinnitus symptoms. Now, I preach a lot about best practices on my channel, specifically when I'm talking about treating your hearing loss with hearing aids. But what about when it comes to treating your tinnitus? Wouldn't you want a best practice approach and more comprehensive approach to treating your tinnitus? Let me know down in the comment section. So basically, what we decided to do is Dr. Craig Casper, myself, Ashley, who's our operations manager, who you also may know as my wife, and Dr. Rachel Cook, who you've probably also seen on my channel primarily talking about hearing loss and tinnitus, are going to be joining forces to launch Modern Tinnitus in Scottsdale, Arizona. Not only do we want to make sure that we're bringing the highest quality tinnitus care to the greater Phoenix Valley, but we also want to develop our Modern Tinnitus method that we can train other audiologists with to make sure that they are able to bring their patients with extremely high quality, comprehensive best practice tinnitus care. Of course, I will be talking more in the future about what we're doing with Modern Tinnitus, so make sure that you are staying tuned to the channel. But this is going to be a really exciting journey. I'm super happy to be able to bring more information and treatment options available to people who are suffering from tinnitus, and not just here in the Scottsdale or Phoenix area. I'm talking literally worldwide. Of course, if you want to learn more about Modern Tinnitus and you want to check out our website, go to moderntinnitus.co, not .com, .co, if you want to learn more about what we're doing. And as always, guys, I'll see you next week.